It is the Chamber's privilege to welcome Dr. Danielle Ripich.
Well, bless my soul, what's wrong with me? I'm itching like a man on a buzzing tree.
This chamber is amazing. I'm an Elvis fan, so that's they got me laughing to start. I really am very pleased to be here with all of you today. Particularly, I thank you, Ron, for that very kind introduction. March is a wonderful month because mud season is just over the horizon, and it's March Madness in basketball. And for UNE, this has been an amazing week. Our women's basketball has won our conference championship, and we'll be playing in Bowdoin on Friday night against Western Connecticut State. And when we win that, on Saturday we'll play the winner of the Bowdoin-Baruch match. So it's an exciting time. Last year our men's basketball made it to the NCAA tournament, and so this year it's the women's turn. And we had a great team. They're almost all girls from Maine. We beat Bates, we beat USM. You know what a great women's program they have. So it's a very exciting time at the university. And I invite you all to Bowdoin on Friday night if you want to see some lively basketball. There are 5 Maine colleges in Division III women's basketball tournaments this year, which is really remarkable, I think. But it's not just on the court that we compete. We really work every day to collaborate. All the colleges and universities work together, not just to educate the children in Maine, but to strengthen the economy of our state. As president of UNE today, a lot of my examples are naturally going to come from my institution, but I assure you, and it's important to note, that the success stories that I'm talking about are repeated at every college and university in our state. And I know I have a number of colleagues here today, so I really enjoy the opportunity to tell you about what we're doing in higher education and in healthcare education. There are 3 things that I want to focus on this morning. First, that access to health care and the demand for services is a critical and growing need in the state of Maine. Second, health care and education are big business in our state. And third, UNE is the leader in healthcare education in Maine, but we certainly do not and cannot do it alone. It's probably not news to any of you in the room today that our health care is costly. In the U.S., 16.2 cents of every dollar is spent on health care. And this is the highest percentage of any developing country or developed country in the world. The rest of the industrialized nations spend an average of 8 cents of every dollar on health care. And I'm educating students for the future, and if they're going to compete in a global economy, you see the disadvantage that they're going to be under if we don't get our health care costs under control. As I said, health care and education are 2 important economic drivers in Maine. At the University of New England, we're committed to both of those. UNE educates more health care professionals, including physicians, for the state of Maine than any college or university in the world. I like to say that, so I'm going to say it one more time. UNE educates more healthcare professionals, including physicians, for the state of Maine than any college or university in the world. Whether you're from Fort Kent or Kittery, the chances are your physician, your dental hygienist, your physical therapist, your nurse, some of your healthcare professionals are graduates of our institution. I like to say we're a private university with a public mission. In most states, the public university system takes on education of healthcare workforce. For some reason, in Maine, that never developed quite that way, and UNE has picked up that as our mission, and we take it very seriously. We care about the state of Maine. Affordable quality health care, we believe, is critical to Maine's economic development and quality of life. Yet shortages exist at almost all levels of Maine's healthcare workforce, especially in the rural areas. This presents challenges, but also some tremendous opportunities. As educators, we help fill the pipeline, but as I said, UNE certainly doesn't do this alone. Reaching out to Maine's rural areas where the needs are most acute is a challenge many of us are working to address. Right now, a quarter, 1 out of every 4 rural physicians in Maine is a UNE graduate. We see that Tufts and Maine Medical Center have a new program looking at rural physicians and primary care, and we're happy that they're coming along because we're going to need them in the future. But we have, as I said, been very serious about our commitment to rural and primary care. About 70% of our physicians go into primary care. This compares to most schools in the country. Less than 10% of those physicians go to primary care. So again, our mission is really very Maine-centric. We think we know what the state needs, and that's what we're trying to address. Healthcare is also big business. In a report last year by the President's Council of Economic Advisors, healthcare was identified as the fastest growing job sector in the U.S. In Maine, it's one of our largest industries. Over 100,000 people work in healthcare in Maine, and 20% of all employment and wages comes from this particular job sector. Healthcare in the future, in the next decade, will account for 1 out of every 3 new jobs in the state. And these are going to be good jobs with good benefits. Healthcare spending in Maine in 2008 was $5.5 billion, 11% of our gross domestic product. It's not a balance that we like very much. We need to get things in better shape, but the good news is that physicians' offices, hospitals, home health care agencies, all of these places employ workers and use services provided by many of the businesses represented here today in the room. This $5.5 billion has a substantial multiplier effect and a substantial impact on the economy of our state. Higher education, specifically healthcare education, is an important economic driver as well. For example, UNE is building a new residence hall on our Biddeford campus. Last week, we had over 1,000 workers on that site. This $26 million building is the largest new construction project in our state, according to Dave Cook, who's I think here today from Allied Cook, and is our contractor. We have engineers, electricians, window framers, you name it, as they are buying local supplies and eating lunch in Biddeford. The C-Star Market loves us in the neighborhood. This one project has had a huge impact. Mike Morrell, the chair of our Board of Trustees, and I were at an event for the new gubernatorial candidates, and there are a lot of them. So we were standing in the corner talking about comparing notes, and a gentleman came up to us and said, in your job you get a lot of complaints, but I want to give you, say something, a thank you to you and UNE. He said, 18 months ago, my concrete business, I had 125 employees, and right now I'm down to 25, and they've all been working on your project on Route 9, but if it weren't for this job and working with Allied Cook on this project, I would have lost my business. And you've held that together for me. So it was a very gratifying feeling, and I think that in the midst of a really tough, very tough economic year, higher education has continued to move forward and continued to grow. The growth in UNE's student body, I believe, it created the demand for this new residence hall, but I think it's because the programs that we offer reflect the kinds of jobs that students are looking for in the future. Applications to our physical therapy program, for example, were up 59% this year. Occupational therapy apps were up 35%. We had over 1,300 applications for 47 slots in our physician assistance program.